Now, the very common one that I have come across is, does sugar feed cancer cells? And the answer to which is no. Now, although the research has shown that cancer cells consume more glucose than normal cells, no study has shown that taking more amount of sugar can worsen your cancer, or if you stop eating sugar, your cancer will shrink or disappear. There's also no evidence that adopting a diet very low in carbs will lower your cancer risk or help as a treatment. As for patients, getting adequate nutrition is important for helping their bodies cope with the treatment. Stopping sugar completely would also mean that your body's healthy cells get starved of necessary sugars. Diets very low in carbs will not only make you lose weight but can also make your immune system less efficient. Having said that, I would also like to make a very important note here that however, a high sugar diet might contribute to excess weight gain, and obesity is associated with increased risk of developing several types of cancer. Also, there is some evidence that consuming large amount of sugar is associated with an increased risk of certain cancers, including esophageal cancer. It can also lead to weight gain and increase the risk of obesity and diabetes, which may increase the risk of cancer. It is the type of sugar that you eat matters a lot. There are two types of sugar. One is a simple carbs and the other one is a complex carbs. Now, the simple carbs are the ones that are devoid of vitamins and minerals and low in fiber, whereas the complex carbs are the ones that are good in fiber and good in vitamins and minerals and help in maintaining your blood sugar levels. Few examples to give you would be whole grains and green leafy vegetables. Therefore, my recommendation is to avoid refined sugar, or for that matter, anything that's processed, which has been stripped of their original nutritional content and fiber. Refined wheat flour, white pasta, white sugar are some of the examples to just give you. I would like to conclude by saying an important rule that you should always remember. The more a food is refined, the more you should stay away from it. Now, does microwaving plastic containers and wraps release harmful or cancer-causing substances in the food? The fact is, microwave-safe plastic containers and wraps are safe to use in the microwave. But plastic containers not intended for use in the microwave could melt and potentially leak chemicals into your food. So, avoid microwaving containers that were never intended for the microwave, such as margarine tubs, takeout containers, or whipped topping bowls. In general, microwaves don't make foods radioactive. They just heat them. It has never been proven that microwaves cause any harm as long as you follow the instructions. Now, these include standing away from it while cooking, closing its door properly before pressing start, and replacing old and broken microwaves which may be leaking more radiation than we want externally. In this respect, microwaves act just like light. When the light bulb is turned off, no light remains. Having said that, microwave does not penetrate well in thicker pieces of food and may produce uneven cooking. Now, this can lead to health risk if parts of the food are not heated sufficiently to kill potentially dangerous microorganisms. Because of the potential for uneven distribution of cooking, food heated in the microwave should rest for several minutes after cooking is completed to allow the heat to distribute throughout the food. Also, we don't recommend using the microwave oven. Please use sparingly or only if required. Cooking and heating fresh food is always much better. Now, soya foods contain several key nutrients and phytochemicals which are studied for their cancer-preventing properties. Many soya foods also contain dietary fiber which may lower the risk of colorectal cancer. Soya foods contain isoflavones, which are phytoestrogens, and that in some ways mimic the action of estrogen but is very weak. Now, high levels of estrogen is linked to increased breast cancer risk. There was a fear that soya foods and the isoflavones in them can increase the risk of breast cancer. But overall, human studies have shown, and also research suggests, that soya may lower the risk. For breast cancer survivors, population studies do not show any harmful interactions between soya foods and anti-estrogen medications. In fact, a small number of studies have also suggested soya foods may be most protective for women who take anti-estrogen agents or aromatase inhibitors. But more research is needed before experts do more than encourage moderate consumption of whole soya foods, that is 1 to 2 servings per day, as a low-fat protein. Over here, we have to talk about the genetically modified soya products that are sold around the world. Again, there is no conclusive evidence about genetically modified foods and its effect on cancer. However, sticking to organic sources when it comes to soya is recommended. Milk and dairy are good sources of calcium and protein which are needed as part of a healthy, balanced diet. Calcium is important for teeth and bone health. Studies looking into the link between cancer and dairy products have not given any clear results. There is evidence that dairy products could reduce the risk of bowel cancer, but we cannot say for sure that this is the case. There is no strong evidence linking dairy products to any other types of cancer. We need further research to find out more about the links between dairy products and cancer risk.